Wonderful keynote presentation there. Lots to digest, lots of really interesting information, particularly around the overlap between private industry, government and regulation, as I said earlier, the holy trinity in our new world of data. So we are going to transition the stage for our next fireside chat. And okay, you guys are ready? Awesome, that's great. And we're just going to get some new chairs onto the stage. If we haven't met already, my name is Oisin Lunny, O-I-S-I-N-L-U-N-N-Y. It's an old Irish name, so it's spelled completely differently to how it's pronounced, like all good Irish names. And it's a real pleasure to be here. I think South Summit is an incredibly impactful and powerful event. As somebody remarked to me last night, it's where you can do a year's worth of business in the space of a couple of days, because the team at South Summit have brought together such a great assembly of global experts, business leaders from Spain, business leaders from all over the world, and a very brilliant and curious and engaged 14,000 delegates, I believe, is how many people have registered. And so, if you're one of those delegates, which you certainly are, please feel free to join the conversation, get involved on social media, use the hashtag SouthSummit18, and it's a great way to connect with other delegates who are active on social media, like myself. Feel free to connect. So I believe we're ready to go with our next fireside chat, and it's all about the road towards well-being, making personalized health a reality. So an incredibly important subject. So please welcome to the stage Ben Joff from Hacks, who's the moderator, and Daniel Nathrath from Ada Health. Thank you. Welcome to the stage. Wonderful. Thank you. Enjoy. Cheers. Hey.
All right. So it's actually pretty cool because we have 30 minutes to ourselves, just two of us. So I'm indicated as moderator, but in fact, it's not going to be a conversation because you're an entrepreneur and you have a health tech company, and we are investors, and we invested in about 30 health and wellness and medical-related device companies. And that's kind of interesting. We're just following the pharma guy because in a way, we're kind of putting a bit of pressure on the pharma people. Each in our own way. So maybe Daniel, why don't you tell us more about what ADA is doing?
Sure. So ADA is what we call the world's personal health guide. The idea is that we give you an app that you can have a conversation with that's very much like a conversation with your trusted family doctor. Mm-hmm. Basically, you open the app, you tell it what problem you're having, and then it'll ask you a series of questions, and then it'll give you an idea of what condition is causing your symptoms and what should be the next steps that you should take to address it. Okay. So basically replacing the good old Googling your symptoms.
So it's kind of a chatbot for medical diagnostic.
Yes, that's part of what we do. We've actually been around for 7 years, and we spent the first 5 years developing a decision support system for doctors. So the patient version that we launched just under 2 years ago is actually only sort of the tip of the iceberg of the technology that we've built. But ever since we put out the patient version, it's getting used a lot more than when we were talking to doctors alone. We launched it just over a year and a half ago, and it did become the #1 medical app in 140 countries. And now every 2 seconds, someone somewhere in the world is entering a new case in ADA.
That's pretty cool. So I'll tell you quickly about what we do. So Hacks is a branch of a fund called SOSV, which is an international fund of 400 million under management. Hacks is the hardware branch. We have offices in Shenzhen, China, to build things, and in Silicon Valley. And we've done, in the past 6 years, about 200 investments in our hardware. So we invest at the prototype stage. The first check is about $100,000. We follow on in seed, on Series A. And our specialty is actually to take startups at very early stage so that they can iterate on their prototype a lot faster thanks to the Shenzhen ecosystem and supply chain and our team based there. And actually, what's really interesting is that about 6 years ago, 5-6 years ago, when we started, we were doing a lot of consumer gadgets. And about 3 years ago, we started to see a lot more medical devices and wellness devices come to us. And that was just right about the time where like Fitbit was everywhere in the media. They hadn't IPO'd yet. And we're wondering, is there really something to do with devices and health? Or is everything done already now that we know the number of steps we take every day? Obviously, there was some more room. And since then, we've invested in companies doing a lot of things ranging from diagnostics. So like we invested in, I think, 4 blood testing companies. So might wonder, why would you do like 4 different blood testing companies? Well, one is doing optical imaging analysis, so they can recognize pathogens in the blood. Another one is testing the blood type, which is really important in case of emergencies. Otherwise, you always end up using the universal donor blood. And so there's actually a lot to do with diagnostics. And more recently, we've seen also companies that don't just diagnose, but also give you some feedback, immediate feedback, so that you can actually do something, or sometimes actually act on your body to help you heal. So one of them is a Swedish company called Flow Neuroscience, which is a device you put on your head that does brain stimulation to treat depression. So antidepressants, pretty big market for pharma, and now you have a device that in 10 minutes can pretty much give you the same effect without the side effects. So that's why I was saying the pharma guys might start to feel a bit of a change on the market. So what I find interesting in here is that we do devices that obviously have some software components and machine learning and sometimes some form of AI. And you guys are pure software guys, and you probably were doing kind of AI-related, machine learning-related things even before it was sexy, right?
That's true. When we started out 7 years ago, a lot of my friends asked me, and probably this went on till like a year ago or so. They never understood what I was working on. To be fair, the first few years I didn't either. But so I think there's clearly a shift in sort of the perception in the industry, but also in the wider population in terms of sort of more awareness of all these tools to sort of manage your own health. I think the basic need to find out what's wrong with you has always been there. Ever since
not just your mom, right?
You
need data now.
Ever since Google things like that came up, I think 9 out of 10 people. Who Googles themselves before they go to the doctor? Probably most people in the room, right?
Sure.
Yeah. So.
Only him.
Or sometimes when you come back from the doctor and you have this uneasy feeling, something wasn't great. So once we put it in the hands of patients, and this is sort of where this personalized health aspect comes in, it really made a shift. And what we see with the devices that you mentioned, I think is very complementary to what we do. Doctors nowadays still, and I think many people don't know this, but more than 80% of all diagnoses are made purely based on patient history. So basically the same thing that ADA does, asking questions and then coming to a conclusion. But I think there's so many possibilities with all these devices, and we will see some winners that will emerge that more people will use. But for us, this is really exciting because we see them basically as input that will make ADA even more accurate.
For decisions.
Exactly. So because we can measure so much more basically on an ongoing basis. I know people who are working on some amazing sleep tracking devices where you spend like probably a third of your life you just spend it sleeping, and you can
entrepreneurs
measure,
a little bit less. But
you can entrepreneurs a bit less, and VCs probably also. And, but there's so much you can do, and we just hired a new head of our US business. He was previously the chief commercial officer for a company called TytoCare from Israel. I don't know if you heard of those guys, but it's kind of like a medical tricorder kind of thing that's trying to measure a lot of things at the same time. And we're always very interested in integrating all that data and using it.
Yeah, the challenge is really how do you collect the data, and that's where devices are actually really necessary, because how do you connect with the physical world if you don't have any physical component? So I just do just quick survey. Who had a health check this year? Raise your hand. Health check this year. Okay, so everyone else, your data is more than a year old, right? So actually, I didn't think too much about this, and then because I feel pretty healthy in general. But this summer I was in the Philippines visiting a friend, and he told me, "Oh, let's go to an island." I was like, "Okay, great, let's go to an island." And he said, "Oh, sorry, the plane is not available. Let's go to a clinic instead." I was like, "What?" He said, "Yeah, it's good to do health checks." So he took me to a shopping mall in Manila, and there were 2 clinics in the shopping mall. And I said, "You can just show up?" He said, "Yeah, you just show up." And then what? He said, "Well, you choose your test. There's a menu." Like, okay, so choose your test. So, well, I don't know. Yeah, cholesterol, why not? Never tried that. Okay, fertility, yeah, maybe. Blood test, yeah, sure. on the ultrasound, yeah, let's take that. STDs for sure, yeah. So that took a bunch of things on the menu, and within a few hours, with $200, I had finally kind of baseline data that I never had before. And my friend convinced me that it was actually worth actually having some baseline when you're healthy, so that at the time you don't feel too well, you can check on, if it doesn't cost a lot, actually you can have regular checks so that you can detect conditions before they're bad. On the previous panel, I was talking about IoT, and one of the panelists is a friend from Silicon Valley, and last time I saw him, it was a little bit, a bit more chubbier, let's say. And I said, oh, what happened? He said, well, I realized I was gluten intolerant. He's French, which is tough, right? So gluten intolerant. I said, so no baguette, no bread, no cakes. And he said, no, well, if it's really good bread, then it's fine. But essentially, he cut most bread because it's super processed in the US. He cut pasta, he cut rice, and he cut probably most cakes. And potatoes, and he lost I don't know how many kilos, and he also switched to one of those funky diets you eat for 8 hours a day, and for 16 you don't. So that's actually, he also told me that the reason that he did that is because he went for a health check, and they told me he's basically pre-diabetic, and if he doesn't change his habits, a year later he's going to be diabetic. And now he's not even pre-diabetic anymore. He's fine. So that's kind of leads me to another thing, and maybe kind of anticipating a little bit, is that one thing we kind of discovered through all those investments is that you can have all the data you want, you can have all the devices you want. The biggest problem, or the biggest contributor to health problems is behavior. That's the hardest thing to change. So I don't know if with your software you have things to kind of tackle that. So in its kind of small way, Fitbit is trying to do that, but giving you buzzes and giving you rewards and kind of reminding you of stuff. But how do you guys deal with that?
Yeah, so the interesting thing about ADA is that people use it really when they already feel sick, usually, in the current form.
Maybe not too sick.
Yeah, well,
they can still change something.
Exactly. So that's usually when a lot of people, myself included, really need a wake-up call, basically. As long it's just human nature. As long as you're feeling fine, you don't really think about your health. For most people, unless you're one of the worried most people start thinking about their health once they have a problem, right?
Yeah, symptom-based.
Yeah, exactly. So that's where we come in, but we get this feedback from our users that it did actually lead to a change in their behavior to finally find out what they have.
So having at least some information about whether or not they have a condition and what they could do.
And as you know, there are a lot of rare diseases out there. There's like 7,000 rare diseases, and a lot of people really suffer because it takes on average 5 to 7 years to even get a diagnosis. So they have all these problems. They don't know what it is.
Because it's rare, sometimes it's not even profitable for companies to develop good therapies, right?
Sure.
So you're kind of stuck with it.
Yeah, and we get this feedback from the users where they leave a review in the App Store. For instance, we have over 100,000 reviews in the App Store. Where people say, I have a rare disease. I didn't know what it was. It took about 10 years. Last year, finally, I found a specialist to diagnose me. I'd seen more than 20 doctors. Just wanted to test your app to see what it would say. So I put my findings and symptoms in, and it told me in 5 minutes what 20 doctors needed more than 10 years for. So
because sometimes the same symptom can be coming from like different diseases, right? That's also...
Yeah, and for us, the next step is then, and that's something we're currently working on, is exactly integrating more more ways to measure on an ongoing basis how a person is. So once we've helped a person identify what their problem is, now we also want to help them manage it and prevent it from getting worse. Like your friend who was pre-diabetic, unfortunately an extremely high percentage of people in the US especially.
Eat a lot of sugar.
Yes, well, I'm guilty of that as well. So I just had a Coke before I got to
everything in moderation.
So those cases, I think the next step for us is to help them identify what the problem is and then to help them manage it so that it doesn't become worse. That's what we're currently working on.
Yeah, so one kind of buzzword that started to emerge, I think about a couple of years ago, is called P4 medicines. So so I always get them wrong, so I took them note. So predictive, preventive, personalized, and participatory. So predictive is to see it coming. Preventive is to prevent it from happening. Personalized because we're all different and the same symptom could be a different condition. And the same treatment could not fit different people, same dosage. And the participatory is also an interesting aspect that if you collect data from many people and you share your data, then it can actually help improve the therapies themselves. One of my colleagues actually had a really kind of stroke of insight when he said, in the future, it's possible that donating your data might be more valuable than donating an organ, because it will benefit many more people. So there's a lot of discussion around sharing data and whether or not that's a good thing. Like, what do you guys think about that?
Yeah, so our philosophy is that the data is always obviously owned by the user. So only the user decides whom they want to share it with. But we do ask the user for permission to contact them, for instance, if their data, for instance, matches a clinical trial where someone is trying to advance medical research, then we ask them for permission if we can then contact them again and present the opportunity to the user, and then they can opt in. So it's like a double opt-in that we give the user.
Do you aggregate data to have like some stats? Because now you have a lot of users. So are there things that came out of the data, or in terms of what kind of conditions, or what kind of treatment, what's emerging, what's evolving? Like,
yeah,
have you figured out things from aggregate data, anonymized data?
Absolutely. We can learn a lot from the data, and I think we're just at the beginning of that. Now we have about 5 million users. We're quite sure that by 2020 we'll have at least 100 million users. And obviously this is a lot of data that comes in all the time, and we can see certain trends. We had an issue where there was an outbreak, I think, of Lassa fever in a country in Africa where we had a lot of users, but we actually didn't have Lassa fever modeled in our database yet as a disease. But we modeled it and ran it sort of retrospectively against the cases that had come in during that time. And we clearly see a spike. So there's so much work to be done. We work
from the new, like the type of people who reported things, you could figure out which were the symptoms and associate it with a disease.
Yes, I mean, and there are a lot of things we can learn. For instance, I didn't know that, I wouldn't have expected such a high percentage of mental health cases as we have. Almost 1 out of 3 cases that we have has at least some mental health component to it, and we can clearly see the differences in prevalence and incidence from different regions in the world. The app, as I said, it became the #1 app in 140 countries, and in Africa, where we have a lot of users, or in India, you obviously see different diseases in the top ranking compared to, let's say, Spain or Germany or something like that. And the more data we can collect, the more we can learn, the more we can refine the model. So it's really, it's kind of a thing where just by using it, you're helping others already. So if I don't achieve anything else today, download Ada, it's in the App Store. And it's available in Spanish, English, German, Portuguese, and French as of right now. We're working on Mandarin and Hindi and Arabic, so a lot of people can use it.
One thing I noticed in the previous presentation was kind of on a quick data point on the slide is the spending on healthcare. I think the presenter was saying, "Oh, look at how much it's growing," but at the very end, it's actually kind of tapering off. And I heard already a couple of times that maybe what we're spending on healthcare is already maxed out. We can't spend more. And now what's interesting is to see the shift from basically symptom-based reactive medicine to shifting those budgets to prevention. For that, actually, the most motivated are not pharma companies, are not hospitals, even though they are sometimes hospitals, but governments and insurers are actually really interested in prevention, because insurers, they make money when they don't need to cover any expense. So they're really motivated to keep you healthy, actually.
Yeah.
So have you had discussions with insurers related to your business?
Yeah, of course, a lot. So, so we're working with payers in general, which could be governments, insurers, sometimes employers, like in the US, and with health systems, and we're getting approached a lot by those players from all over the world. In Germany, we're working with some of the largest health insurers, as well as in other countries and with the NHS. And clearly they're interested in several things. They want to have more engagement of their covered population, but they also see us as a first port of call, kind of a pre-primary care filter. You know that the GP in most systems has kind of this gatekeeper functionality
to a first layer of customer service.
A first layer, exactly. And we can then help the patient direct them to the right next step in the care journey. And I don't know if you're aware of this, but one big problem in many countries is that people go straight to the emergency room when they shouldn't, which causes a lot of cost and basically blocks it for people who really need it. If you have a cold and you go to the emergency room, that's not a good idea. Often that's just because people don't know better. So we can help with that. But the other aspect, as you say, is certainly also to catch things early, prevent them from... So kind of, I always say, right now what we're doing is we're sort of preventing the 1,000 euro problem from becoming a 100,000 euro problem, but the next step for us will be to even prevent it from ever becoming a 1,000 euro problem, and for that we'd love to work with some of your device startups, for instance.
Well, one thing you said when we were chatting a little bit earlier is that you found that people prefer talking to your chatbot than talking to a real human, and that seemed to be a surprise for you when you kind of implemented that.
Yeah, so when we started out, we have a different background from some other players in this space. So most of those companies that are calling themselves sort of AI companies, symptom checker companies, they started out as Skype a doctor type telehealth companies, and then they realized this doesn't really scale very well because you still need one doctor for one patient at a time.
Doctor's time.
Exactly. Yeah. So then they said, okay, let's build a symptom checker, and then they started calling themselves AI companies. Some of them also claim to be better than doctors. Don't believe it, unless I say it. But and I'm not saying it. Sorry, yes. So what we realized, we also thought in the beginning we should offer the user the opportunity to speak with a human doctor at the end of the automated assessment. So we offered that in the UK. But what we saw was that the conversion rate was extremely low. And when we sort of asked the net promoter score type questions, the satisfaction with the automated ADA assessment was actually a lot higher than with the talking to a doctor, even though they were good doctors and everything was fine. But what we see is, especially for certain conditions like mental health or sexual health, and then especially in certain parts of the world, like in the Arab world, people are just more comfortable initially talking to a bot. And you know, coming back to these reviews, a lot of people say, I know it's just a bot, but it already reduces my anxiety to have the ability to have a conversation like that.
Well, that's really quite interesting to see that, because in some professions, people are worried that software is going to replace like jobs. But what we see is that in the health space, there's not enough practitioners. There's not enough doctors, not enough people to take care of all the problems.
Yes.
So anything that allows a doctor to treat not 10 but 100 or 1,000 patients, or see them at a later stage in terms of diagnostic, allows them to actually kind of treat many more people. Right?
Yeah, so there's a global shortage of 7 million health workers. And obviously, if you look at India or certain parts of Africa, a lot of people, more than 1 billion people, will actually never see a doctor in their life. And if they, because someone in their vicinity has a cheap smartphone, if they suddenly get access to diagnostic information that's as good or better compared to what a GP for the richest in London or Silicon Valley could do, then I think that's an amazing improvement, and that's great.
So I see we only have a couple of minutes left. So I have just a couple of other ideas we could talk about. So one, it was around like this kind of aspect of behavior change, which is problematic for like even when you diagnose people, you give them like medicine to take, like prescription adherence, like people just taking their medicine is not that good. So that's one. On the other, and I'm not sure we're going to have time for that, is once you've started treating conditions and you see you can make people better, you can actually, and you start preventing conditions, you can also start thinking, okay, could we actually improve people beyond what they're normally capable of? So human augmentation is kind of the potential next step.
Yeah, I mean, that's certainly the
super well.
Yeah, well, so that's certainly the idea we started out with. I mean, our idea was really to augment the intelligence of doctors. That's what we worked on in the beginning, and that's still our idea. So the idea is not to sort of replace the doctor, but to empower the patient and then to also empower the doctor and to make the whole journey more efficient. So if the patient has finished the assessment, they can share it with their doctor, then the doctor already knows before they even take a first look at the actual patient, they already have a briefing, they can start from there, and the doctor then also gets support to make the better ultimate diagnosis. And so that's really, we think that helps to, as you say, make the patient super well in the end.
I think what I'm looking forward to is actually, I mentioned earlier a device company that can do brain stimulation. And at the moment, they're using it to treat depression. But they could actually stimulate pretty much any area of your brain and potentially help you memorize things better. Or
I'll try it.
Do a lot of other stuff. And there's, so I think that's an interesting avenue once you start to have devices or medicine that can take care of you in a more precise way. So that's... We have some more time?
Absolutely.
Oh, okay.
All right, so,
All right.
but, well...
No, it's just, we're waiting on one more speaker.
No problem.
So
Okay.
the stage is yours.
Maybe
okay.
there's some questions from the audience.
Sure, we can take questions. Why not? Yeah. Anybody has a question? If you have a little bit all
Your
of a
hand
sudden.
up. We
So
do have a
yes,
gentleman with a microphone.
one here,
Lots
there.
of questions. One.
You have one user more, because I was trying to...
One more user.
You have one more user. I was just joining the app. I just found out a topic. Is there any way, for example, in rare diseases, it's quite hard to define symptoms?
Yes.
So I was just blocked on the first, not the first, but actually the first real question about health. How can you deal with it? Because we need to describe symptoms in a way that your database can recognize it. So how can we deal with it?
Yeah, I think we get, so obviously, I don't know how far you got in the question flow, but we have a lot of questions. We don't cover all 7,000 rare diseases yet. We cover maybe 10% of that. But we get feedback from patients where sometimes they tell us, I was trying to say this and I couldn't. And then we have a team of about 130 people right now in Berlin, London, Munich, and in New York. And a lot of them are doctors who improve our medical knowledge base. And then if someone writes to us, I couldn't describe this, or my rare disease is not reflected, then we try to add that to the database. So we're working on that.
Okay. I think there was another question in the back there. Yeah.
Oh, there we go. First of all, thanks. It's really enlightening. And my question is more towards, do you see a future where these kind of solutions will be funded by public healthcare systems? Especially, I'm thinking about Europe, right? And Spain, where it's very restrictive, where there's public tenders, all this kind of stuff. And if you do see that future, how far is it?
So I can maybe start with that, because a few of our companies, they start by working with doctors, and either doctors use devices or hospitals start to use devices and are not kind of reimbursed for the device, but that helps them do better diagnostics, so it helps improve the processes. But there's also some devices that manage to get in the reimbursement system, in which case, it could be paid by public money. It's kind of a case-by-case basis, and obviously it's kind of a long road, because first you need FDA approval, you need to do all the clinical trials, then you need to go through all the paperwork of getting into the reimbursement system. Totally possible.
So for us, it's happening now. We're in active negotiations with several governments, and we're already working with some NGOs to make data available to those who need it most in Africa. We have a partnership with a Swiss foundation called the Botner Foundation, and we're also working with the Gates Foundation. And we just won something called Frontlines of Health at the MIT Solve Challenge. And an Artificial Intelligence for the Betterment of Humanity Prize by the Patrick McGovern Foundation. So we're already working with sort of public health bodies, but we also work, for instance, with the NHS in the UK, and we've been contacted by governments from Asia and Africa as well to work on this. Because it's quite obvious that the idea is to empower patients to have better outcomes, but clearly, there's also a huge cost-saving potential, and this is also why the private and public health insurers are so interested in working with us. We're quite convinced that we can probably save them 10% of their total cost through the various benefits that we offer.
I think we're out of time. Thanks for your questions and for your patience. Thank you.